Hi, my name is Dr. William Aaron Kunkle. I go by Aaron Kunkle, actually. I'm the fourth William in a row in my family, so in order for us to keep everyone straight, I go by Aaron. I'm an orthopedic spine surgeon, fellowship trained and board certified. So this is the start of my 7th year in practice. I've moved around a little bit. I was in North Carolina for the beginning portion of my practice, and then I unfortunately had my mother pass away, so I went home to Indiana to help my father out, but trained down here in South Florida. Always wanted to get back down here, and this tremendous opportunity with FSA came up, and I've been with the practice since December. The staff always say, I'll joke around with them, involve them with conversations, see how their days go, really check up on them. But at the same time, we work hard to make sure that we get our day accomplished efficiently. I'm a big sports guy. I used to play soccer throughout college, would still play, but I'm too old now, so I'll probably blow my knee out. Cut that part out. But I love sports. I love soccer. I like American football. I really enjoy watching sports when I can. I have 2 young children, so they take up a lot of my times now. So my sport now is chasing them. But yeah, I'm a big sports guy. My mother was a nurse, and my father has been in healthcare administration and actually just retired recently. So I grew up kind of around healthcare and always kind of enjoyed it and had some interest in it. But as I got further along and worked in hospitals before I went to medical school, I really saw the other side of medicine and how much you can affect someone's life and how much you can change it. I really liked spine, for example, because people that have nerve pain can be very debilitated, and it's not, that their heart's going to stop, but the pain, it's so unrelenting that they may feel like that at times. And being able to give people the ability to get back and play with their kids, or to get back on the sports field, or to get back to just a functioning daily life is really important. It's really cool to see when you can take someone that's absolutely miserable and get them to a much more functional place in life and return them back to having a smile on their face. When I approach a patient, I always take the approach of I'm treating a family member, because at the end of the day, I want to make sure that they're getting provided with the same amount of care that I would expect for my family to be provided. That's the approach I'll take for everyone. With my approach to spinal care and pathology, I really try to involve the patients in their treatment process. A lot of the stuff that we see here is non-emergent or life-threatening scenarios, but they are life-altering scenarios, and they can really change the functionality of someone and can really change how they go about their daily lives and daily activities. So by involving them in their care and giving them the options for various treatments, we can really make sure that we develop a good approach that the patient is comfortable with, but one that also is going to try to get them back to that functional level and return them back to the life that they want to live. So I've been a member of FSA since December of 2023, recently started here. I knew Dr. Norton when I was training down here, and he was just beginning the FSA practice. I really liked what he was doing, developing a comprehensive spine clinic and practice. As a result, I always envisioned myself in that type of practice setting. I've been in multi-specialty orthopedic practices before, but because of my specialty and solely focused on spine, I really appreciate having that comprehensive spine practice where we have pain management integrated in with spine surgery, and we can coalesce very well. So FSA offers very unique opportunities and benefits to patients. What we can provide here at FSA is when you come in, we can not only treat your pain from a non-operative standpoint or non-invasive standpoint with physical therapy, medications, but we can progress that on in a very sequential manner to more and more invasive treatments and ultimately surgery if that's what's needed. A lot of times we can get you better without surgery, but when surgery is necessary, FSA offers comprehensive treatment of all spinal conditions. My patients, they tell me that I'm attentive, I listen to their needs and to what's causing them pain. And once we've had the opportunity to discuss what's causing their pain, we then try to treat them in a non-operative fashion at first, if possible, and then take that all the way to a surgical option if necessary. And when we ever get to that surgical option, if it's there, we try to do the least invasive treatment options available to us. So anywhere from endoscopic spine surgery all the way up to minimally invasive fusion procedures where we need to implant screws and rods for stabilizations at time. FSA has a very unique and blossoming culture where we have board-certified, fellowship-trained spine surgeons that we can work collaboratively with. We can bounce cases off one another. We can make sure that we're giving the best, most up-to-date and appropriate treatment for our patients. And we combine that with top-notch pain management care with board-certified and fellowship-trained pain management physicians that can provide us anywhere from non-operative injections to spinal cord stimulators to pain pumps. So we can really offer these patients anything they need related to spinal care, whether that's their neck, mid-back, low back, really the whole spine care is able to be done here at FSA.